Hello, and welcome to Discussions with the Director. My name is Shileste Overton Morris, and I'm the Chief Program Officer at the Central Susquehanna Intermediate Unit, and also serve as Director at the Center for Schools and Communities. These discussions give me the opportunity to talk to you about how our core values connect with our work here at the Center. Our core values include service to others, equity in action, passion for excellence, and innovation for growth. Today's discussion will focus on service to others and equity in action, and I would also like to say passion for excellence, I believe, as we talk about our work to support the mental health needs of educators and students through the Center for Safe Schools. Today, I'm speaking with Michelle Kern. She is the Safe Schools Coordinator at the Center for Safe Schools. Welcome, Michelle.
Thank you. I'm happy to be here.
Glad to have you. But Michelle, we're in the middle of the school year, and we know that folks might be getting a little tired around this time of year. And so can you talk to us about what mental health concerns you are seeing in school districts that you serve?
Yeah, so one of the good things is the stigma in mental health is decreasing. So therefore, talking about it is becoming more widely accepted in the students, in the teachers, and in leadership. However, the need for services is widely increasing, and the demand for them is not keeping up with the need. So some of the statistics around this is the Pennsylvania Youth Survey, also known as PAYS in Pennsylvania, from 2021 indicated that 40.1% of students reported feeling sad or depressed most days. And students reported self-harm behaviors increasing in all grades. Now, we have to take into consideration that these are students who are coming back to in-person right after the pandemic. So in 2023 was the year that PAYS, so just ended in the fall, and those new statistics and data will be released soon in 2024. Now, I think what I've been hearing from teachers and students is that mental health and behavioral needs became much more transparent after the pandemic and as students transitioned back to in-person. However, many of those barriers were the same from before the pandemic. So you have that lack of transportation to get to these services. You have long wait lists. So there might be some mental health needs or mental health services in the community, but you have a long wait list. There's a long wait between one appointment to the next. You have lack of parent follow through. So the teachers are asking the parents to get an appointment and they're not following through. There's just a larger scale of need. Also, teachers are being expected to be more than just an educator now. They're now a case manager. They are now a social worker, and now a caretaker. They're being asked to do a lot more than need. And it takes a toll on their own mental health. Teachers still love their students. As I talk to teachers, there's never anyone that says that they feel tired of being a teacher. They feel tired of the extra burden that is put on them. And the burnout is real as I talk to these teachers. And I feel it as I go across the state.
Yeah, I think one of the things that we have seen and from the data and from anecdotal conversations with educators and students is the impact of COVID continues to be one of the things that really has impacted both the academic side, but also the mental health of both students and teachers. And I think as we continue to see what those impacts are, we will see more and more increases in the number of supports that both educators and students need, especially around their mental health. And so glad that the Center for Safe Schools is able to support districts and community-based organizations in those efforts. So can you tell me how you are helping those districts and community-based organizations to do that?
Yeah, so one of the main things that I love that the Center for Safe Schools does is we tailor professional development to fit the needs of the district and of the school. For example, one of our new trainings that we have provided is our Self-Care Institute. So it's been really popular now that we've rolled it out. So it can be a 90-minute, it can be 3.5 hours, or it can be 5.5 hours,
Wow.
depending on what the school needs, on what the teachers need. And we've been asked to do it multiple times now. And it just gives the teachers a sense of safety and teaches them the tools they need to take care of themselves and take it back to the classrooms for their students as well.
Great.
Another thing that I also love to do is our Act 44 Safety and Security Assessments, which also includes a behavioral health and climate assessment. This is when we go into a school and assess what it's like to be a staff member, a teacher, or a community member in a school. And this is one of my favorite things to do because I get to see what a school is like, and I get to talk to the teachers, and this is when I find out what they need, and I help make recommendations on how to make it better, and give those recommendations on different professional developments and simple things that administration might not think of. It might just be a closed loop communication system so teachers feel more in the loop of what's going on in a school. Another thing is I am a youth mental health first aid trainer, and I strongly believe that everyone can make a difference in just knowing the basics on youth mental health, because just like a regular first aid, you're just knowing the basics on how to help someone until the professionals arrive. And with this, you're just knowing the basics on mental health until the real mental health providers can get there.
And that's so important, and I know that's such a great analogy. You know, I think about Stop the Bleed, right?
Yes.
And that program that teaches you how, in an emergency, to conduct yourself and to support the other person while there may be an injury, until, as you said, the real professionals who are trained to help more deeply. And what else is it that you're doing? Sorry to interrupt you for that.
Sorry. Yeah, well, and I think so many times people forget to, or get scared to ask about suicide. And that program teaches you how to ask about suicidal thoughts and just get the resources in place so that the professionals can take over, which I think is a great program and a great resource.
And we do know that the statistics around suicidal ideation have greatly increased in both rural and urban areas. So, and among middle to high school grades especially. So, knowing what to do is critically important. And I hope that our audience, if they haven't been trained in those kinds of strategies, that they will definitely reach out and do that. It's really important for our students.
Yes, and like I said, I'm a trainer and I believe strongly in it, so they're free to contact me. And then the other thing that we also do is we are helping with addressing educational mandates. They change often. It feels like a moving goalpost sometimes. So we are constantly in contact with our state partners to understand the changing mandates. I know one that has been a little iffy right now is Act 55 because it came out and we're just trying to figure out what that looks like, where are the changing hours, how many hours do educators need. So we just try to help schools so that it's a little less stress on them. So that's one of the other things that we do.
Yeah, I know at the time of this taping, the state legislature just passed some changes to the school code, and it includes some things around school safety and mental health. So as you said, things are constantly changing, and because they're mandates, districts are required to comply. And so having resource for districts to help them keep up to date. I know our Safe Schools Director, Joey Melvin, has a weekly e-blast that he shares with school safety professionals and other interested people around school safety issues. So I know that is one of the ways we are also helping districts to keep up to date. And so you're part of a team, and I know we've spoken with Leah and Joey previously, and thinking about mental health and the connects with other initiatives here. Leah, she talked about bullying prevention. We know that for those who are bullied, certainly it impacts their mental health negatively. And thinking about, again, our work with pregnant and parenting teens, certainly depression can arise from young parents and the stressors that they experience as new parents who are trying to finish their education. And even our work, as I said, with students experiencing homelessness in foster care. Certainly they have a large percentage of students who report mental health challenges like feeling depressed. And so kudos to you and the team for all the work that you're doing to work with other initiatives here at the center to support our most challenged populations. So Michelle, can you share with us from your knowledge and experience some strategies that educators might be able to use in working with students who are facing mental health challenges?
With continuing to talk about suicide prevention, Act 71, educators grades 6 through 12 must have 4 hours of suicide prevention training every 5 years. This does not mean and should not mean that they have the same 101 every time, and I recommend that teachers advocate for themselves to ask for different types of suicide prevention training and ask for more advanced. I talk to educators who are like, yep, same old 101 every year.
And even more than those 4 hours
Yes.
if they feel particularly that they need that
Yes.
in order to deal with their own student population.
100%. But yeah, so I advocate for them to ask for what they need with their leadership. And also want to mention that as of 2 years ago, there is now an easier number to call the Suicide and Crisis Hotline. It is 988, and posters are available that they can get off a line and hang in their classrooms for everyone to see, and it can be hung in their staff room as well. I also want to circle back to the PAYS data that I mentioned. Like I said, it's being compiled now and should be available soon for their districts. It is also available on the Pennsylvania Commission of Crime and Delinquency website. It will be available for their state and their county, and they should remind their leadership that they can use that as they are looking to advocate for their district, their state, to get resources that they need for mental health. And I want to also share that the Center for Safe Schools can also be a resource for them, that we can help them look at data and policies that they might be making for mental health, and they're making for emergency management and their all hazards plan. We have their youth mental health first aid training, and we have the Self-Care Institute. We also have some other training that they might be interested in, and they can check out on our website, which is centerforsafeschools.org. And they can also reach out to me, and I can help them with some of those things.
Yeah, thank you so much, Michelle. I really encourage our audience to reach out to the Center for Safe Schools and take advantage of these resources and tools. It's so important, especially as we have learned today about the increases in students facing mental health challenges, as well as educators and focusing on their self-care and well-being. I know we talked a lot about suicide today, but, mental health challenges show up in all different forms, anxiety, depression, bullying, right? And so I just really think it is important for those listening today to know that we're here for them, especially in these challenging times. So thank you again for all you do for the center and for the Center for Safe Schools. And we look forward to hearing from you soon about more work that you're engaged in.
Thank you.
Hope you learn more about CSC and how we live our values. Please visit our website and YouTube channel for more information. Thank you and see you next month.